Welcome to the Arizona Sunset Podcast. Our goal is to seek senior solutions for aging problems. Now your host, Justin Owens.
Welcome to this episode of the Arizona Sunset Podcast. Today's guest is Beth O'Connor with the Virginia Rural Health Association, and she is also the host of the Rural Health Voice podcast. Welcome, Beth.
Hello.
Can you start briefly explaining what the Virginia Rural Health Association is and your role there?
Sure. So the Virginia Rural Health Association is a nonprofit advocacy organization working to improve the lives of the 2.5 million people who call rural Virginia their home. We are not unique. We are under the umbrella of the National Rural Health Association, and most states, including Arizona, have their own Rural Health Association in the state.
And then besides hosting the podcast there, what else do you do?
Oh, mercy. So we've got about 1,000 members statewide, and we provide a variety of services for our members. One is information, such as our own podcast. We also produce a weekly electronic newsletter to make sure people stay up to date at what's going on at the state and the national level. We have educational events. We've got a conference coming up this fall where people can get together and talk about rural issues, rural health in their communities, and what we can do to address those problems. And then also advocacy. I spend part of my time talking to our elected officials about how the decisions they make affect health and healthcare in rural America.
As far as the education goes, does that go on like the healthcare provider side, or does it go on like the individual person?
Right. So as an advocacy organization, our members are generally hospital administrators, clinic directors, faculty at healthcare professional schools, such as medical schools and nursing schools. And so the education is typically more learning about best practices in their field and what resources and tools they can bring back to their communities and their patients.
So it's more with the organizations that provide
right.
How best to serve the rural community.
Yep. One of the things that we know with our rural communities is many of our facility directors, say clinic director, is a person who's wearing many, many hats. And so they don't have time to keep up to date on maybe regulation changes, on new practices that are out there, things like that. We actually applied for a grant a few years ago, and we were asked to contact the IT director of a rural health clinic, which is hilarious because the idea of a rural health clinic having their own IT director, that's just not going to happen. The clinic director is doing everything all at once.
I used to work for a small company, and people would call and ask for the marketing department or ask for this department. And it was me, right? And
the department. Sure, guys.
Yeah, hold on, let me put you on hold and I'll transfer you to me. Do you find that, and this is kind of a general question, but with that type of clinic where they're wearing many hats, is the service any less than in the larger cities because they're having to, they can't specialize, right? They're having to learn jack of all trades kind of thing.
Right. So, there's kind of two sides of that. You're not going to get the access to every ologist under the sun that you're going to have in the urban area. And, for many times problem things are going to be referred out. But the flip side of that, for our rural communities, our rural hospitals, our rural clinics, the person in exam room 3 isn't a number on a chart. They're your neighbor. They're your uncle. They're your Sunday school teacher. They're your high school principal. They might be all of those things all at the same time wrapped up in one person. Just like you don't have a marketing department, rural communities, we have people who fill a lot of roles all at once. And so because you know that person on an individual level, you're going to care more about that person, and you're going to know more about that background. You're going to know whether or not they have clean water coming out of the tap at home. You're going to know whether or not they've got a family member that can check in on them and make sure their wounds are dressed correctly. You're going to know a lot more about that person than if you're in an urban facility.
So at least with that respect, they're able to provide better care because they have that background, just because it is a small community.
Yep, and that can be documented. The quality of care in our rural hospitals is higher than our urban facilities.
Do you have any type of statistic on when it comes to healthcare? Like in this case, in a rural setting, I imagine most general medicine doctor, primary care physician, could handle a large percentage of the emergencies or the reasons people need to go to a doctor in the first place? Do you have any idea of what that number might be?
Yeah, I don't have a number off the top of my head, but what I can tell you is that on a nationwide basis, your small town hospital and clinic is actually going to be a more cost-effective method because they've learned how to do more than with less, and they don't automatically refer you out to a specialist because they know the specialist might be 2, 4, maybe 6 hours away.
Yeah. How does living in a rural setting pose challenges to getting health care? And this could not necessarily senior related, but just in general.
Sure. So there's the obvious answer of in a rural community, you're going to have a greater distance to service. Again, maybe that specialist that you need, the endocrinologist, the dermatologist, the liver guy might be 4 hours away, might be in a different state. You think about the barriers of giving into a specialist in the first place. Maybe there's a 6-month wait time, for my dermatologist. Well, if there's a 6-month wait time and it's a 4-hour trip, that in and of itself is going to be very difficult. Some of the other barriers in rural communities, people in general tend to be older. They tend to have more chronic diseases. So it's not just diabetes. It's not just a COPD issue. It's not just some cardiovascular disease. People tend to have more of those things all at once in our rural communities. And third, people in our rural communities tend to be lower income. They're more likely to be poor than urban areas, which means they're going to have less access to high quality insurance.
Is there any research, or do you have any data on why they think that is? Why is the rural community older, have more chronic diseases and lower income?
Well, in general, there's a variety of things that pile into that. But when you think about how people in rural communities tend to have to go outside of the community for education and outside of the community for employment, Arizona is obviously very different from Virginia. But if you're in, and I haven't lived in Arizona for a long time, so I'm going to pull Yuma County off the top of my head here.
Okay.
Here in Yuma County, where are you going to go to get a 4-year education?
Not in Yuma County.
Right, not in Yuma County. So You're going to graduate from high school and leave Yuma County. You're going to get your 4-year degree in whatever this is in business, in engineering, in whatever. Where are you going to get a job once you get that degree? Not in Yuma County.
Metropolitan area, probably.
Metropolitan area. So in general, and this is a big oversimplification, but in general, those higher paying jobs are going to be in your urban communities. And so we see people leaving rural to go to urban to get those higher paying positions. And too often they don't move back. Yeah. A friend of mine has a saying that the number one export in Southwest Virginia isn't coal, it's 18 to 24-year-olds.
Yeah, that's pretty funny.
And so when you pull out that younger, high-income population, what's left is going to be older, is going to be poorer, is going to be sicker.
Well, and one thing I've noticed too is that as in most big cities around the country, the cost of living is higher. Real estate is much higher. Other things like that. So I could see some people who are looking to, whether it's because they have lower income or it's because they're trying to lower their cost of living, seek out rural.
Absolutely. And that's a big thing that we try to promote when we're recruiting healthcare providers to our rural communities is your debt load from medical school may be the same, whether you live in big urban or a little town. But look at the size of the house you can buy in your small town versus what you can get in the middle of Mesa, Scottsdale, wherever.
Yeah, it's true. It's gotten crazy here. And a friend of mine who I grew up with in Chandler, they recently posted their home for sale up in Show Low area. And Show Low is a smaller community than the Phoenix area, and homes there are very affordable. But the problem is, if you live in a rural area and you're trying to make the move, later in life with an established family or something, it's a lot harder to make that move because you're selling for, say, $200,000. You're trying to buy a similar home, and it's going to be $300,000-$400,000 in the bigger city.
Absolutely.
So you mentioned people in rural communities have more chronic diseases. Do you think that's a function of inadequate health care, or maybe as a part of the lower income, just having less access to whether it's less access to healthcare or quality nutrition, things like that?
Yeah, it's a combination of all those things. Certainly, the lack of healthcare providers is going to be a factor. If you, again, have to go to 4 hours to see the specialist, are you going to go tomorrow, or are you going to wait and put it off and put it off and put it off until you can't wait anymore? So that's absolutely a factor. Rural communities tend to have less things like exercise facilities. There's not a whole lot of gyms and wellness centers and yoga studios in our rural communities. And, as you said, nutrition. It's interesting to me, the number of people I run into that assume that everybody in rural America has a healthy diet because, hey, you can just grow your own. And I would say those people have obviously never tried to tend their own vegetable garden.
It's a lot of work.
And grow enough food to feed their family. That is hard work. Even in Arizona, where your growing season is fairly long, it's still an incredible amount of work. And people who do that, really tend to not have outside employment because it's so hard to do both.
It is. Yeah. It ties you to your property. I mean, whether you have a garden or animals or both, it really ties you down and you're unable to leave. And I have a garden right now that's gone crazy because I love gardening in the winter. The weather's great. It's nice. But once summer comes, it goes crazy and it's hot. I don't want to go out there and work in the garden. I have a very small garden, mind you, but it just goes crazy. I just don't get to everything and things will go rotting. And I know someone, a dear man who turned 70 this year. It's my father. And whenever I bring up, or my brothers and I bring up his age and the fact that he lives in a rural community, he lives 15 minutes from a town that has no streetlight, and probably an hour from a town with decent medical facilities. One thing we bring up are there's no viable health care. If something happens to you at home, it's a long way for an ambulance. It's a long way for mom to drive. And he's got this attitude that, hey, I'm just going to have a heart attack out in the field doing my chores, and he's just going to go that way. Like he's got it all planned how he's going to happen. He doesn't want to convalesce or, I don't know, live a life with reduced capacity. Do you find that attitude common among people who live in rural settings?
Oh, absolutely. One of the things we know about our rural folks is they're very independent. They're used to being self-sufficient. They don't want someone else helping them. That's seen as, somehow being degrading or lesser. My mom is in a very similar situation as your dad. She's on 40 acres of Minnesota farmland, 10 miles from anything that would resemble a town, and probably a good 45 minutes from a major medical center. If she has a heart attack, I'm not entirely sure who would find her when.
No, that's a good point.
But is she going to move? No.
Do you find that attitude and not accepting health or not accepting help translate to healthcare too? Like they just don't want to go to the doctor. They don't want to be told what to do. They just, like you said, distance-wise and proximity-wise, they are far from the specialist and they put things off. But not only that, but just the attitude of being independent and the attitude that brought them to the rural community to begin with can prevent them from seeking and attaining adequate healthcare.
Absolutely. And it's a source of pride. Hey, look what we did by ourselves with our own gumption. Why would they give that up?
I definitely have. There is some of that my dad instilled in me, and I love small towns. If I could move and have be able to find employment and do that, I would. But for now, I'm stuck in a big city. What types of programs are available or resources for people in smaller communities? Do you direct residents or patients? Do you have any type of program to help them understand the process to get adequate healthcare?
So for pretty much anywhere in the nation, I would highly recommend finding your local area agency on aging. They tend to be great resources, not in terms of finding the right resources for healthcare, but also things like transportation, nutrition, all of that whole package that goes into people being able to live independently. One
thing that I've noticed that until you need healthcare, until you need, to get, say, in-home health services through your Medicaid insurer or whatever, like until you do it, you have no idea how to do it. And then even when you're going through the process, it's making phone calls, following up, being transferred here and there and trying to find out the right people to call to get the the right doctor's orders to get that in place. It takes a long time. And I imagine for those who live in rural settings who want those services, it can be even more challenging just because of the lack of the proximity to those resources.
Well, sure. There's proximity issues. There's technology issues. How do you find anything anymore? Google knows everything. But for a lot of our, older Americans, the internet's not necessarily a friendly place. It's confusing. They don't know how to use it. In rural America, maybe you don't have broadband at all. Mm-hmm. So it can be harder to find those resources.
Before we started talking, you had mentioned that the recent discussion on doing away with the Postal Service. How would that affect the rural resident?
Sure. So a couple of years ago, and I think this has died, but one of the things that was being talked about at the national level to try to reduce costs was to cut back on mail delivery. With the rise of the internet, there are very few actual pieces of mail that go out anymore. There's plenty of junk mail, but think about when's the last time you got a letter with a stamp on it, a real actual stamp. And because of that, one of the potential options people were talking about was, maybe we can curb rural mail delivery. Maybe they can just go into town and pick it up at the post office. But one of the things that we know for our rural citizens, because, like your dad, they live alone, or in your case, not your dad, but, if your mom wasn't around, if your dad lived alone, is going to be independent, is not going to move into town, is not going to move into assisted living. It's not that uncommon for the first person to notice there's a problem being the mail carrier. That's the first person that goes, hey, Grandma Jones hasn't picked up her mail in 3 days. I wonder what the heck's going on. Not that uncommon for that person to be the first person to raise the alarm.
Now that you tell that story, I thought that my parents have a P.O. box. So shoot, if something happens, even a postman's going to know.
Right.
But it's interesting too. And I think some of that independent mentality may be a challenge in getting people in rural communities to network and to get to know each other. I mean, it's a lot of people move there to not have that, to be, to get away from people. But I think even more so, it's important to know your neighbors, know your people around you, just for that very reason, just to kind of check up on each other.
Oh, absolutely. I will be honest and tell you that I have no idea what the names are for my neighbors on the left and the right of me. I know the people direct across the street. I do not know the people on either side.
You don't know them at all? Or you don't know them by name?
I don't know their name. I would not recognize them if I bumped into them in Walmart. I have no idea who they are. Wow.
Okay. I think I know all my neighbors by face, but I for the life of me, I just don't remember their names, except for one. Okay. You mentioned, so Arizona does have a rural health association, and you mentioned, was it the Agency on Aging? What was that?
So nationally, it's called the Area Agencies on Aging. And they typically have a statewide entity and then local chapters. So maybe one agency on agency may cover 2 or 3 counties, although Arizona counties are pretty big, so you may only have 1 per county.
Okay, I'll look that up and we'll link it in our notes. Yeah, whenever I travel outside of Arizona, especially in the south and along the East Coast, I'm amazed at how small counties are, because our counties are enormous. we get to, when we're coming back from southern Arizona or Mexico, we get to Maricopa County, where Phoenix is, but we're still an hour away from home because the counties are just enormous. Is there anything else that you've seen, or with the work that you've done with the podcast, with the Virginia Rural Health Association, that might be of benefit to seniors in the community?
Well, yes, something that other people should think about is, one of the common ways for seniors to be able to stay in their homes long term is having home health aides, having those people come in, check on them, making sure they're eating, making sure they're taking their medications appropriately. But one of the things that we know with our national legislation is home health aides don't get paid mileage. So if you're going to take on, say, 5, 10, however many clients, are you going to pick Grandma Smith that lives 25 miles out of town one way? Probably not. And that's not saying home health aides are greedy or selfish or whatever else. They're trying to put food on the table just like everybody else. But until that legislation changes, they don't get paid mileage through Medicaid and Medicare.
Yeah, that could be pretty huge. especially when there's 10, 20, 30 miles between towns. And who knows if there's even an aide in a town nearby. It may be a long way. Is there any legislation in the works right now that would change that?
I'm not aware of anything right now, but it never hurts to pick up the phone and contact your member of Congress and say, hey, we got a problem.
Yeah, that is a problem. Sounds like the Medicare, Medicaid works as long as you're in a big city. But are there other shortcomings besides that mileage with the home health? I mean, that's a pretty big one.
Yeah, the other thing in a rural community is, I sort of mentioned this earlier, but again, thinking about people being able to stay at home, be independent longer, is the issue with broadband access in rural areas. One of the things that we can do is home health monitoring. There's machines and systems set up where, say for example, a woman has a special kind of heart condition where she needs to get her weight and her blood pressure taken on a weekly basis, or maybe more often. Is it easier for her to drive into town, wait however long she has to the doctor's office, get her weight and her blood pressure and turn around and drive back? Or if there is a smart device in her home where it does it automatically for her and uploads the information automatically to the doctor's office, what's a better use of her time, of the doctor's time, of the clinic's time, of the taxpayer dollars? But none of those things work if we don't have broadband access.
Correct me if I'm wrong, but most people, I assume the only option if there's no broadband is going to be dial-up if you have a landline or a satellite type internet system.
Yeah, and depending on the level of service, dial-up for smart devices simply is not going to work. That just won't do a thing. Satellite's getting better. Whether or not it would support that level of service, I'm not sure. It probably would, but until we make progress in those areas, it's still going to be a limitation.
Yeah, and not only that, but I imagine as children of an aging parent in a rural community, if I had, if my parents were struggling, or if I could get a little Wi-Fi camera or something and put it in their house, in a common area, so I could just know that they're up and they're okay and they're not lying on the floor, passed out or something. But yeah, like you said, if there's no internet access, that's really hard to pull off.
It puts that out of reach.
Do you know of any technology apart from laying, miles and miles of cable to rural communities that would help get the speeds up?
Right. So the FCC just announced a big broadband expansion package, and so they're working on filling those gaps, but it's going to take time and money.
And that's cables, right? Like wires and cables, not like over the air.
It's a combination. There's some actual fiber. There's repeaters. They're doing a combination of approaches because not everything works everywhere. Here in the mountains of Southwest Virginia, laying fiber is prohibitively expensive, so they have to look to other options.
Gotcha. Okay. And you said that that's in the works, or it's legislation that people are working on, or the FCC said that it's...
The FCC's doing it.
Okay, good. But like you said, time and money, it's going to take a while the United States is pretty big to cover. Are there any other challenges that people who have Medicare as their sole insurance face in rural communities?
Well, certainly, for rural communities, you're going to have fewer options. When you look at the various, Medicare Part D plans or whatever else, it's not unusual for people in rural communities to have exactly one choice. And so then obviously doing comparison shopping and all that sort of stuff
and second opinions. And
second opinions is harder when there's exactly one choice. Or maybe easier because there's only one choice, but it certainly doesn't make it more cost effective.
I think most people, when there's a diagnosis, or even not even like a cancer or something like that, but just people are getting second opinions, and there's different ways of doing things. And if you have, I don't know, if you have the doctor that everyone knows that that you've gone to forever, I wonder if it'd be harder because you have that personal relationship to get a second opinion. I mean, would they be offended? I don't know.
Sometimes, absolutely.
I'm assuming I would assume that the close relationship has its benefits and drawbacks.
Yeah, it goes both ways. You get someone that knows you and your family history, and that can better inform your healthcare. But you can also get personal relationship conflicts. Is the doctor married to your sister-in-law, and does that cause problems? There's all sorts of things going to that in rural communities.
Is there any, I don't know if you've heard of anything, and this is kind of just out there. I don't know if you would know, but is there any type of like a robot that could like be an in-home health aid? I mean, they're making all these strides with, robots doing all kinds of crazy things, and so some of them are appropriate for this conversation. But like, you'd think that the more and more we get, like there would be someone would be able to create like a robot to help with the activities of daily living, making sure they're eating and taking the pills and sleeping, and I don't know. I don't know about a robot, but there's certainly machines out there. There's definitely programmable machines to make sure people take their medications correctly. They can be set up so that they're only dispensed at certain times, so that an alarm goes off to somebody if they aren't taken. Keeps them from taking them more often than they're supposed to, because it will only release the certain amount at the certain time. Those options are out there. And again, there's plenty of smart devices that can help take your temperature, take your weight, take your blood pressure, check your cholesterol, check your blood sugar. All of that can be done electronically now. I have got to do some research then. So this pill machine, would it be something like the weekly thing, but it's got like an alarm or a system where they only open at the right time? Sure. So you think about your basic plastic pill boxes where there's a box for Monday and a box for Tuesday. Well, these things tend to be circular, so they rotate. And it's say 8 a.m. Monday, it will rotate to that section and pop out your breakfast pills. And then at 1 p.m. Monday, it'll rotate to that section and pop out your lunch pills. And that way, you can't accidentally take Monday and Tuesday because you forgot what day you're on. Mm-hmm. And also, it can tell whether or not you actually pick those pills up. Now, there's no guarantee you actually swallowed the pill, so that's certainly still a flaw in the system. They were available at least. But at least they were available, and you can tell whether or not they were picked up out of the machine. Okay, wow. Yeah, people have been hiding pills under their tongue forever, so I don't know if that's always going to be a challenge. But I think the big thing with that is you can't take too many by accident because you forgot whether or not you took them. Yeah, that's good. Plus, it's just a reminder. Sometimes you just forget and you push it off, then you forget the next one. Then you're like, you're just way off. And depending on the medication, that can make a big difference. Absolutely. Okay. All right, Beth, I think that was the questions that I had. Did you have anything else? Oh, I know about that. I would, certainly encourage folks, if you're concerned about, the seniors and their healthcare in your rural community, I would encourage people to get involved, talk to people in other people in their community, talk to their elected officials, see what you can get done to make it better. And you mentioned contacting the elected officials. What are there? And you mentioned, I think there's about 1,000 people in the Virginia Rural Health Association. Was it that big? So are there like local in small towns? There's like people to get involved, or what would that look like? Pretty much any town that's got a hospital is going to have some sort of community health coalition. Okay. I would definitely say call your local clinic, call your hospital, say, hey, what can I do to volunteer, to get involved, to do more, to do better? Okay. And would that be like the social worker, or who at the hospital would be the one to go to? For that one, something. Yeah, I would say, I just call the administrative office. They'll shift you around wherever they need to. Okay. It'll be a different person at each place. Sounds good. All right, so I am going to link to your information to the Arizona Rural Health Association. I've got to find this pill machine that I'm fascinated about, and any other in-home technology that I can find. I think that would be fun to research. Oh boy, that's what I got in my head right now. Okay. I think it's something I'll tell you. Awesome. Well, yeah, I can include that. But for now, Beth, thank you for your time today and for all that you are doing to help the people living in rural communities. Beyond that, all of your advocacy that I see on Facebook, the positive quotes that you post, I enjoy reading those. So thank you for all that you do. Thank you.